I'm Mohammed Jailan. I'm the Director of Cardiology at the Aga Khan University Hospital. I'm an interventional cardiologist, which means that a large proportion of the work that I do is treating patients who are having heart attacks or people who are about to have a heart attack and need some specific intervention done to try and prevent that from happening. One of the most interesting conditions because they present quite suddenly, and if they present quickly they can be treated quite effectively. 97% of people who end up in hospitals like our hospital, if they arrive on time, will have their treatment completely delivered and they'll be able to leave hospital alive. But the patients who delay, and unfortunately up to 50% of patients delay, and that same 50% of patients who delay have a very high risk of death. So 1 out of 2 people don't even make it into a hospital at any given time. If we look at the statistics and the trends around the world, actually coronary artery disease and heart attacks in developed countries, in parts of North America and Europe, actually is the second biggest cause of death. But worldwide, the biggest cause of death indeed is heart attacks and coronary artery disease. Why? Well, the reason is that the interventions and the initiatives that have been taken and put in place in Europe and North America are beginning to work, some 20, 30 years after they were introduced. We need to do the same thing on this part of the world. So in low and middle income countries, most patients, the most common cause of death remains heart attacks. And heart attacks and coronary artery disease will eclipse, for instance, coronavirus, probably between 10 and 50 times in different countries. So if you look at the number of people who might be dying from coronavirus in low and middle income countries at the moment, 50 times that number are dying on a daily basis from coronary artery disease. Maybe I can just start by explaining what it is that happens when you have a heart attack. The heart is a pump, and the job of this pump is to send blood to the rest of the body. Because it's pumping 60 to 100 times every minute, it needs its own blood supply. And the blood comes to it through vessels which are about 2 to 3 millimeters in diameter, called coronary arteries. When those coronary arteries get narrowed and you try and exert yourself, let's just say that you're going for a jog and the artery has started to get narrowed, and it's usually narrowed because of cholesterol. If that happens, then the heart will not get enough oxygen, and the way that it will tell you is by giving you a signal like a discomfort in the chest or a pain. When you stop exercising, the heart doesn't need that much oxygen at that stage. At that stage, the oxygen supply will be met, it'll catch up, and the pain will go away. So some people have an early warning, which we call angina. If it happens daily and is happening increasingly frequent, we would describe that as unstable angina. But a full-blown heart attack occurs when that vessel gets blocked, usually abruptly, when the narrowing becomes so severe that there's very little oxygen and blood going past that vessel. And when that happens, the symptoms happen quite quickly. And the symptoms that most people describe are the same discomfort, maybe a bit more severe, associated with some sweating, difficulty breathing, some anxiety, and sometimes nausea, the sense that you may feel like you need to vomit. So as I said, if you get to hospital quickly enough, there's usually a system in care to help deal with patients, but you have to go to the right hospital. These are what we call heart attack centers, and there are very few heart attack centers in sub-Saharan Africa, very few in Kenya. Even in Nairobi, many hospitals are not set up as heart attack centers. A heart attack center will be able to diagnose a heart attack. In other words, it will do an ECG, confirm from the ECG test. An ECG test is an electrical signal of the heart, whether you're having a heart attack at that moment. And if the ECG is not very clear, you can do a blood test to support it. These tests need to be done quickly because a heart attack is an immediate threat to your life. If the heart attack is confirmed on the ECG or from the blood test, then you're usually offered one of 2 major treatments. One of them is something to break up the blood clot, because usually the thing that blocks the vessel at that last stage is a blood clot. And there are two ways to do that. The best, quickest way and most accessible is to take aspirin, but that only does it treats only part of that clot, and the clot is likely to come back or not disappear completely with aspirin. And another clot breaking medicine, what we call a thrombolysis, a breaker of clots, can be put in your vein, and it may take some time to work. While we're giving you the medicine, we need to monitor you, because heart attacks can convert very quickly into very dangerous heart rhythms where the heart actually stops. And so when you come to a heart attack center, as we do the ECG, as we diagnose a heart attack, we connect you to a monitoring device called a defibrillator. And if we discover that you need immediate treatment because you're about to suffer a cardiac arrest, the heart is going to stop, then we offer the defibrillator. The best treatment, though, isn't a drug like aspirin or a clot breaker, but is an actual procedure which was developed in Europe in the early 90s and has been used in Kenya since probably the mid-2000s, and we've been using it in Aga Khan on the vast majority of heart attack patients. This is what we call angioplasty. And to do an angioplasty, what happens is, as soon as a diagnosis is made, we try and get you into the cath lab within 60 minutes. A cath lab is an operating space with a very clever X-ray machine that can look into the heart, and if we inject a special dye, you can see the contours of the main vessels. And if any of those vessels is pinched or narrowed, then we can detect where the problem is, and usually using a small wire and a balloon, within 15 minutes of detecting the problem, we've usually addressed the problem. So it's a very quick, very efficient process. It requires a very skilled team, which includes an interventional cardiologist, a radiographer, 2 to 3 nurses, and some other support staff, all of whom are convening around a single patient, trying to, if you like, prevent sudden death or to save a life. Poor dietary habits, not exercising, cigarette smoke, stressful existence, not allowing yourself to get enough rest, obesity, alcohol, especially if excessive, contribute to this group of conditions. So if you have discovered that you are in one of these spaces, it's very important to try and address that. So one of the things that we noticed with COVID-19 in the early stages was concern about coming to a hospital. And around the world, many more people have died because they didn't go to a hospital, because they were worried about whatever social media seems to be saying about hospitals. And as a result, the number of people dying at home, dying suddenly, and when we've eventually discovered many of those were dying of heart attacks, that number has increased significantly in the last 6 months. So as well as informing people that it is more dangerous and more common for people to die from heart attacks than from coronavirus, the other thing to do is to make sure that when people come into hospital, they feel confident that what's going to happen in hospital is well prepped. So in this suite here, facilities to treat heart attacks inside our cath lab suite, what we've got is a very clear protocol that protects people and staff, so that if you're having a heart attack, very quickly our team, if necessary, can don the appropriate equipment to try and protect you and themselves from any problems. And that process of donning the equipment has been fast-tracked, if you like, and we've become much, much more efficient through drills and practices at doing that. On the other hand, if you develop a problem like chest pain or a heart attack, get it checked out quickly. As I said, more than 50% of patients who get the symptoms don't make it into hospital on time. And largely this is because they don't know that the symptoms are serious and that they need to go. What symptoms should you pay attention to? Discomfort in the chest, in the upper tumbo, this area here, which many people think might be a stomach indigestion problem, it could quite conceivably be related to the heart, and any of the arms or even the lower jaw. If this happens quite abruptly and you can't explain it, find your way.
Thanks for watching. If you have learned something, please subscribe to our channel and turn on the notification bell and give it a thumbs up, and don't forget to leave a comment in the comment section below to be the first to get subsequent releases through our channel. And if you're on phone or on tablet, don't forget to like and subscribe and turn on the notification bell as well, and help us share with your friends and family. We love you. Home Kiosk TV.